Hey, welcome everybody. Why don't we get started? Hi. Welcome everyone to this webinar on ensuring the future of essential health data for all Americans. I know we still have a few people joining, but let's get started. And thank you all so much for being here. I'm Joel Gurin. I'm the president of the Center for Open Data Enterprise, or CODE. We're a nonprofit organization based in Washington whose mission is to harness the power of open and shared data for the public good. In order to implement our mission, we do a lot of different kinds of things. We do a lot of public information outreach, like this webinar, also including research papers, websites, and so on. We do roundtables like the one tomorrow that some of you will be joining. And a lot of our work really has focused on health. We've done projects multiple times with the Department of Health and Human Services, with other independent health organizations, and with a particular focus on data on the social determinants of health. So we're very grateful to be holding this webinar and tomorrow's roundtable with support from the Robert Wood Johnson Foundation and in partnership with the National Conference on Citizenship, who you'll be hearing from a bit later on. And wonderful to have, at this count, at least 80 people and more coming on joining. So why are we here today? Well, I think everybody on this call is committed to developing a better and more equitable system for for improving health and for improving healthcare. To do that, we know we need data. We need extensive, reliable, diverse data, not only on healthcare, but on all the social and demographic factors that impact health. And we also know that we are now at a moment where we are at risk of losing a lot of the data that we have relied on at a federal level. There have been dramatic changes, of course, at the Department of Health and Human Services and actually across many federal agencies that relate to the nation's health in one way or another, that collect key data sets and scientific data that's now at risk. So what we're going to be talking about today really is, what do we do about that? We have a phenomenal panel, and thanks in advance to all our amazing panelists who are going to be giving many different perspectives on how they see the challenges of the current moment and the actions that can be taken. We'll then give folks a chance to sort of comment on what they've heard from other panelists, and we will then go to your questions in a Q&A session. So just a little bit of housekeeping before we get started. As you can see, we're recording this webinar. We want to make it available later on for people who could not make this particular time. We are going to keep, other than panelists, we are going to keep you all on mute, but please do use the chat. The chat will be open throughout the webinar. And in particular, please use chat if you have questions for the panelists so that we can get to as many of those as possible at the end. This webinar will go to 1 o'clock Eastern Time. If you are participating in tomorrow's roundtable, we ask you to please stay on, because from 1 to 1:30 Eastern, we'll have a little bit of time just to talk about the logistics of the roundtable tomorrow. So with all of that, let's get started. What I'm going to do is I'm going to go around. I'm going to ask each of our panelists, I'll give them a brief introduction and then ask them a question to talk about, to give their perspective, go on to the next. And by the end of this time, I think we will have really all learned a lot and have a lot to discuss. So let me begin with Dr. Alonzo Plough. Dr. Plough has been a national leader in public health for over 25 years. He's the Vice President for Research, Evaluation, Learning, and the Chief Science Officer at the Robert Wood Johnson Foundation, where he's responsible for aligning all of the foundation's work with the best evidence from research and practice, and he oversees grant-making portfolios focused on innovation and emerging issues. Dr. Plough, welcome, and thank you for being here. We would very much like to thank the Robert Wood Johnson Foundation for supporting this project, and turn to you to help welcome our audience and open the discussion. So this project is one of many that the foundation is supporting to protect and improve America's health data. I wonder if you could please tell us why this is such an important concern for the foundation right now, and describe some of the things you're doing to address it.
Great. Well, thank you for the good work that you've been putting in on this one. Uh,
Thank you.
this very quickly emerged, the crisis of the elimination of critical public health data quickly emerged as a very top priority for the foundation to address. We had been working optimistically before January of this year on with CDC and others, through I think many of you know our commission to essentially improve public health, national public health data, to build on what we had to make it more accessible, to learn from the experiences of COVID, and develop a better, more community connected, probably more granular and more effective way to engage with the data and communities. Certainly after January 20th, the protection of our existing data became primary. And I'm responding from my position at the foundation, but my mindset is my 30 years as a director of county and large and city health departments, for us to see the elimination of what is so critical to the practice of governmental public health made this rise to a top priority for the foundation, one of only five for across the entire foundation. So we have moved from and Joel and Code is one of these, a cohort of rapid response grants that we made to now about a dozen organizations, beginning around assessing what is the scope of the problem, who is archiving data, and support of some of what I would call these reactive approaches to the immediacy. And there's been great discussions, one of which was just before this meeting today. That has begun to change, and our focus has begun to change into what is it going to mean to develop sustainable alternative or ancillary data systems to support at state, local, and regional levels the missing federal data support. As we've been saying in philanthropy, we can keep certain things on life support, certain data, certain research on life support, but the orders of magnitude difference between our funding and the federal funding that's gone is huge. But we're committing to doing what we can do. I think the good news is that across health philanthropy and other philanthropy, there is a great convergence and interest in active meeting of the philanthropic sector around the data issue. We can talk more about that. So that's good to see. So what is emerging with the foundation's funding and a lot of our collaboration and our grantees is this movement to what does this alternative data system look like? How can it have a more local, regional, granular presence? How can we not just react, but actually think about this crisis as an opportunity to still continue to work on some of the better data that we wanted to work on prior to this conference? And so we're trying to work on both of those tracks. This will be a critical part of our funding as we move into really trying to support organizations that can operate within, as Joel knows, at least some of the segments of what is missing in the data. And probably from this morning's discussion, I would say four kind of lanes of that. Classic public health surveillance data that supports governmental public health and community work. Um, um, Hospital related and healthcare data, um, environmental determinants data, and then the entire lane of social economic determinants, housing. These are, as we've been working on this for the last few months, I think it's time to kind of disaggregate a little bit and think about some of the specific work that's happening in each of those streams. And that's how the philanthropic funders are thinking about it. Restoring trust in data in a situation like this becomes essential. Also, building that trust with a deep level of bottom-up community engagement in what these systems look like is paramount. And I know the work that the foundation will be doing, and we've got special board authorizations to do this work at scale. We'll be trying to connect. Again, the trust is built in the base. A trusted set of systems that can help to patch for what's missing. I'll just end also on those of us who've been in public health for years. I never thought I would have to be funding work that deals with the federal dis and misinformation around public health messaging and the entire retreat of the federal government for what I would call evidence-based population health. But we're going to be working very actively in funding counter information to that trend. So Joel, let me just stop with that and um,
No, thank you so much. No, that was just, I think, a phenomenal kind of way of laying the table for what we're discussing. And I think all of us on this call just deeply appreciate what the Robert Wood Johnson Foundation is doing to take leadership in this area. And as you just described, even those four lanes are huge, and an awful lot of work to be done, and opportunities to do it. So, kind of staying with that theme of where are we going forward in the future and moving not only from looking at data preservation, but also looking to future systems. Going to turn next to Denice Ross. Denice is the former U.S. Chief Data Scientist and has held several other data leadership positions in and out of government. She's been an expert in data policy for more than 2 decades, now leading a number of projects to address changes in federal data systems and strengthen our national data infrastructure. And Denice, thank you again for being here. You have such deep experience with federal data systems. You know the strengths and vulnerabilities of our national data systems. If you could share with us what you think are some of the biggest risks to national data right now and some of the best strategies to be sure that the country has the data we need, particularly for data relating in one way or another to public health.
Yeah, thank you, Joel. So I have been watching closely what's happening with the federal data ecosystem, along with a group of federal data watchers across domains, and we've noticed three main themes in the patterns of what's happening. The first is the targeted removal of data elements that are not aligned with this administration's priorities. Just last week, Freilich and Kesselheim published an article in The Lancet that was entitled Data Manipulation Within the US Government. And they looked at data from HHS, CDC, and the VA that had been updated in the first 2 months of the administration. And they found that nearly half of those 232 data sets that had been updated were altered. And most of those were the targeted change from the word gender to the word sex. So that was obviously in response to the executive order on gender ideology that came out of the White House. But we've also seen data about DEI, such as race and ethnicity in the Office of Personnel Management's data on the federal workforce disappear. And also data sets like NOAA's billion-dollar disaster data set has been discontinued. So that's one pattern, is this targeted removal of data. The second is, thank you for putting that link in, Maggie. The second is the large-scale degradation of the federal data apparatus. This includes through staffing cuts, canceled contracts, both contracts to facilitate collection, processing, and analysis of the data, but also the technical services and software that are needed to keep data safe and to manage the workflows. And then, of course, there's the disbanding of the scientific advisory committees. This is all going to have a much larger impact on the data we depend on and will be harder to recover from in the long term, this large-scale degradation of the apparatus. And then the third area that Alonzo touched on is trust in government. We know it's been declining for the last 2 decades, and trust impacts data in a couple of ways. One, on whether people will fill out forms and surveys, especially questions about demographics and other characteristics that might make them feel vulnerable. And also whether people believe the data that are released by the federal government. On that first matter, talk of an autism registry, a national citizenship database, and the federal government requiring unfettered access to safety net data from states, those are all likely to have a chilling effect on people filling out detailed questions in the forms and surveys that they receive. And we are hearing anecdotal reports of people not even seeking out services that they need out of fear of having their information in these systems. On the second matter of people trusting data from the government, one of the most troubling findings in last week's Lancet article was that not only were half of the changes to the health-related data sets politically motivated, only 15 of the 114 adulterated data sets included documentation about the change. So that's obviously going to have some cascading impacts on trust in the data that are being published. And then thinking ahead, or for the near term, about strategies to be sure that we have the data that we need. As Alonzo mentioned, nothing can replace the role of federal government for collecting and sharing data, especially data about public health. So with that in mind, there are three things that we can do to help shore up the flow of federal data. And the first one is to identify the public health data sets that you deem most essential. And I encourage folks to think broadly about those data sets, not just data about health outcomes and disease surveillance, but also operational metrics, for example, on how long it takes different states to get coverage to somebody after submitting a Medicaid application. Or data sets like clinicaltrials.gov or the NIH Comparative Genomics Resource. And also data sets on the rates of the uninsured that might come out from American Community Survey or National Health Information Survey. The second is, once you've identified those essential data sets, is to keep an eye on those data for any changes or opportunities for public input. One way to monitor the data is by signing up for the weekly notices at dataindex.us. We are tracking proposed changes to federal data collected through forms and surveys, and also opportunities for public input through the Federal Register. So we're doing that heavy lift so you all don't have to. You can focus on just making the case for why these data are important. And speaking of that, the third recommendation that I have is to be sure to tell the story about how these data benefit American lives and livelihoods. And as far as telling this story about why data are essential for America's well-being, I would encourage you to visit essentialdata.us and submit a sentence describing why your favorite data set matters. Just to give you a few examples, like one thing that we're trying to do is shift the discussion from why these data are important for researchers to why these data matter for everyday Americans. So one example would be a working parent calls their state Medicaid office during their lunch break to renew healthcare coverage for their family. And they wait on hold only 10 minutes instead of 3 hours because CMS's data provides transparency and accountability on state call center wait times, and the states don't want to look bad among their peers. So that encourages them to get their wait times down. Another example would be a person with asthma is flying to a wedding and is wondering if they should mask up during their trip to reduce the risk of catching a respiratory infection. They would visit the CDC's National Wastewater Surveillance System to inform that decision. And then lastly, with the dramatic changes in Medicaid requirements, journalists, policymakers, and advocates interested in a first look at any impact on health insurance coverage would likely want to use a data set like the National Health Interview Survey, which is administered by NCHS and the Census Bureau. So all that said, I think we are going to need to get creative about what our plan B is, and I'm grateful for the work of the Robert Wood Johnson Foundation and others coming together to think about what some alternatives might be to fill these essential data gaps, and especially building the capacity of state and local entities to rise to the occasion. Back to you, Joel.
Great. Denice, thank you so much. And really such thanks to you and your colleagues who are doing this really foundational work on helping us all identify changes that may be coming and push back as necessary. You ended by talking a little bit about NCHS data, which is a perfect segue for us. Our next panelist is Charles Rothwell, who was director for of the National Center for Health Statistics, or NCHS, from 2013 to 2019. He came to the federal government service in 1987 as associate director of NCHS, where he later served as the center's director of vital statistics before becoming its director. And before entering federal service, he spent 13 years in the State Health Department of North Carolina, where he became the first director of the State Center for Health Statistics. So, Charlie, welcome. Thank you for joining us. Based on all the years that you were at NCHS, many of those as its director, the NCHS has been central to so much of what we know about health in this country. I wonder if you could just describe for folks who may not know a little bit about the scope of data that NCHS is responsible for, and how do you see the current situation, both in terms of the risks to federal health data and possibly also the opportunity to address problems with data that we've seen in the past?
Thanks, Joel. Be glad to try. First, let me briefly describe the role and data activities of the National Center for Health Statistics, or NCHS. NCHS is one of 13 principal federal statistical agencies in our country's very, very decentralized federal statistical system. It collects data directly through its own surveys with in-person interviews, as well as through actual physical exams and associated lab testing. NCH also, through collaborative system with all the states and territories, collects the vital statistics of the U.S., that is, all recorded birth and death records. NCHS also links their data with data sets across HHS and other departments. These data are then used to measure the health of people across our country and important subgroups within our population and monitor trends in their health conditions and behaviors and characteristics. And the data is also used to support other biomedical, public health, and health services research activities of others. And finally, it's used to guide public policies and programs and track the impact of policy changes. Its role is only to inform policy debate and the impact of policy changes through trusted and useful data. So what's unique about NCHS and many of the other agencies in the federal statistical system is that they have fixed schedules when they publish their reports, as well as the releases of the detailed data sets that are used to generate those reports. Now, the availability of these data sets is absolutely critical to allow researchers and policy wonks to analyze the data in different ways and examine different issues, and also to assure everyone that we're not cooking the books. So what's wrong? Certainly at this particular moment, but as well as in the past. Well, NCHS data collection is mostly survey-based, which was highly successful for decades. But now, with lowering response rates, causing increased costs per interview, along with a lack of needed geographical granularity, survey reliability and usefulness is starting to come into question. Yet no innovation funding has been provided to examine how other existing and emerging data sources could be used to augment and perhaps replace these surveys. In fact, its budget has been cut, as has the budgets of many of the HHS agencies, as has been described. And many of those agencies actually fund NCHS data collection activities. Also, there's no longer an outside advisory committee assessing the usefulness of NCHS data products. Staffing loss has further delayed the timeliness of NCHS's data, which has for years needed to be improved through use of new technologies and data sources. And recently, there have been actually several proposed new locations for NCHS and HHS, which indicates that the current administration is unsure of the role of NCHS. Now, this concern is heightened by other federal statistical agencies being essentially defunded, as in the Department of Education, or suffering significant cuts, as in Agriculture or the National Science Foundation and the Department of Energy. Also, there have been recent reductions in the economic data provided by the Bureau of Labor Statistics and the Bureau of Economic Analysis. Clearly, the decentralized federal statistical system is in peril. And in my opinion, it's not so much by design as by unintended consequences of broader moves in parent departments, as well as few people, either in or out of government, and either now or in the past, know where the data actually comes from. Which is why there is now an outside study going on, supported by the American Statistical Association, to consider ways to centralize the federal statistical system to improve its timeliness and data sharing through new technologies and improved efficiencies. The failure of our ability to provide more granular, timely, and shared data to better inform policy action to combat, for example, the diseases of despair, provide direction during national disasters and the COVID pandemic, show that appropriate change needs to take place now. Frankly, I applaud the effort of ASA in this tumultuous time. For now, Now is the time to make constructive changes that make sense to all parties interested in a recognized source of useful and trusted data, monitoring the outcomes through shared data of our very interconnected and complex society. Now, Joel, maybe some of the folks don't really know the types of data that NCHS collects itself, but it's data that provides the information for our life table expectancies. It provides the data for the leading causes of death and emerging changing in causes of death. It looks at the prevalence of selected diseases. It looks at changes in health insurance coverage and related health outcomes. It provides obesity rates. It provides birth rates. It provides infant mortality data. It provides a nutrition data that's used for the National Nutrition Guidelines. It provides data for our children's growth charts. It monitors the changes in healthcare utilization. It provides data on reproductive health, et cetera, et cetera, et cetera. So I think these are data that people understand and use and need. Thank you.
Charlie, thank you so much. And I just want to highlight one or two things you said very briefly. One is, I think, the point that, Denice, you talked a lot about changes that may be politically motivated to these data sets. But Charlie, I think you're pointing out also that some of these changes may really be due to inadequate funding, inadequate support, which we're seeing across federal statistical agencies in many different ways. And I know that I believe there's a group called Friends of NCHS. I know there are advocacy groups who are now pushing for adequate funding because it's, as you said, this is important to everybody. It's important to American businesses. It's important to healthcare professionals. So hopefully we can find some ways forward to push for what's needed there. But thank you. And on that note, we're now going to turn to the Centers for Disease Control and Prevention. Dr. Ann Schuchat is here. She's an internist and epidemiologist whose career at the CDC spanned 33 years. She was the agency's principal deputy director from 2015 to 2021, served twice as acting CDC director. From 2006 to 2015, she was the first director of CDC's National Center for Immunization and Respiratory Diseases, where she led the nation's immunization program and the global deployment of vaccines against pneumonia and meningitis. And Dr. Schuchat, thank you so much for joining us. So I want to ask you, the CDC is now facing cutbacks that can have a huge impact on public health, including impacts on immunization and preventive medicine, things that the CDC, does on the ground. But there is also a concern that cutbacks could impact surveillance data. That includes both the data we need to track and fight infectious diseases, and also data on things like the health effects of tobacco and other kinds of health risks. I wonder if you could please tell us about the surveillance aspect of CDC's work and what concerns you most about these current changes to our data resources.
Yeah, thanks so much, and appreciate the chance to be part of this panel. The CDC's surveillance really underpins all of what we do in public health. But I think in contrast to some of the NCHS systems that Charlie was highlighting, which of course NCHS is currently part of CDC, I wanted to focus on the more active part of public health surveillance. And that really starts at the local and state health department level, because surveillance is very much a self-correcting enterprise that is not a one-way thing. The idea is surveillance provides information on trends, but also emerging issues, program effectiveness, and then it initiates response, whether it's a case of tuberculosis that needs active follow-up or a cluster of measles that may indicate a larger problem. While state and local jurisdictions have the authority, there are many conditions that cross jurisdictional lines, and you just can look no further than the current outbreak of measles that initiated in Canada, I believe, and then caused quite a bit of problems in Texas, and then 37 states now have measles, some of which is linked to the Texas outbreak. I wanted to focus on 4 areas briefly: the people, the systems, the governance, and the trust. And I think trust is probably something each of us will touch on. The people are very much local and state health departments, but they need linkage with their community and they need linkage with the healthcare sector. And the healthcare to public health linkage way before this administration has been a problem. As the healthcare sector has gotten more technologically sophisticated, the health department concept has been really cut out. And that we could see in COVID was a huge challenge. In terms of the systems, it's pretty well known that public health systems needed modernization. We knew that before COVID, and COVID made it very clear. But the resources that have gone in to try to modernize the public health systems have been interrupted. And so some of that modernization, got far enough that I think it can be maintained, but a lot of that hasn't. And so, you can look to Minnesota's immunization registry modernization, which was going to help them really understand what was going on with immunization levels in a low burden way and a timely way. And that just really got curtailed when the resources were rescinded from the federal government. About 80% of CDC's budget goes to state and locals, and a whole lot of the state health department's budget comes from the feds. So the ability to really update the systems to take advantage of technology is threatened right now. The third area is governance and processes, and the federal surveillance systems are really not federal. They are aggregations of state and local jurisdictions who have to agree on what they will report and on when they will report it and how they will report it. And so agreements on case definitions, agreements on timelines, agreements on which system to use are very much a labor-intensive coordination process. When the federal government decides that the federal agencies shouldn't communicate with states, this really interrupts the governance process. And then lastly, I just want to mention trust, because it's really fundamental, whether it's the initial event reporting from a patient or a clinician to the state and local system, or from the state and locals to the federal system. We need to be part of the same family to really make the surveillance data actionable. I lastly would just mention a couple of the systems that you probably know about, but ranging from the syndromic surveillance that comes in from emergency rooms that helps us understand what's going on with respiratory seasonal illness, but also understanding a new problem like the e-cigarette or vaping associated lung injury that came out of nowhere. And we really needed the syndromic data from hospitals to understand when we were making progress or not. The PRAM system, the Pregnancy Risk Assessment Monitoring System, is really the only thing that interviews women before, during, and after delivery to understand the risk factors and protective behaviors that are so critical to maternal and child health. The behavioral risk factors surveillance system, the youth risk behavior system, how we track, obesity, smoking, all of those systems are federally funded, needed modernization, may or may not be there in the future. We get fantastic data from NCHS about death certificates, but the injury surveillance systems can help us understand before you die. And even for the deaths, they can have supplemental data that helps us understand what happened before the suicide, what happened before the homicide, what happened before the overdose, what were the factors that are really key for us to know about so that we can intervene. Cancer registries, avian flu in healthcare in farm workers, and then all the injury surveillance that NIOSH does, or the leading causes of injury and illness and death among workers. So those are really the vital systems that CDC integrates or participates in that are threatened, either because we haven't resourced them or because the partners we depend on at the local and state level are really hurting, or because of the ideological issues. Maybe the last thing I would say, I've said that 3 times now, but the last thing I really will say is we have a saying, you guys probably do too, that what gets measured gets done. And what you stop measuring is probably going to get undone. And so the progress that we've made may really be threatened when we stop looking. Thanks.
Thank you so much, Dr. Schuchat. And I think you've really described why this data is so critical in a way that impacts everybody in this country. This is not an abstraction. This is not abstract or academic research data. We're really talking about data that's essential to the health of the country. And thank you for laying that out. I want to turn now to Meeta Anand. Meeta is the Senior Director of Census and Data Equity for the Leadership Conference on Civil and Human Rights and the Leadership Conference Education Fund. She has also worked with the New York Immigration Coalition, has extensive experience in advocacy, strategic planning, and community engagement. She's a graduate of Harvard Law School and holds a master's degree from the Fletcher School at Tufts University. And Meeta, thanks so much for joining us. So I want to ask you, the Leadership Conference is doing a lot of work to protect disaggregated data, the kinds of data that let us analyze the needs of Americans by race, ethnicity, gender, sexual orientation, or disability. And the Leadership Conference has actually launched the Data Disaggregation Action Network, or DDAN, to improve data quality and access. I'd like you to talk a little bit about why disaggregated data is so important, and how are you all identifying risks to this data and some possible solutions?
Wonderful. Thank you so much, Joel. And I am going to try to do this in 5 minutes to get us back on track. I pride myself on meeting these challenges, so let's see how it goes. I have seen about a third or half of you before, so some of you will have heard this before. For others, if I don't hit the topics, please feel free to reach out to me afterwards. So, the Data Disaggregation Action Network works at both the federal and state levels in trying to improve the collection and dissemination of data disaggregated by race and ethnicity. We also do some work around sexual orientation and gender identity. Right now, there are a range of threats we are seeing, but I'm going to address one thing first, and then I'm going to hit the 4 main threats. So a lot of our work really focuses at the national level on the Census Bureau, because as we know, the denominator is affecting everything that we're doing and also sets the frames for a lot of the work that we're talking about. When the Census Bureau released SPD 15 revisions, one of the most powerful components of that release was the third requirement. People focused on the combined question. People focused on adding a Middle Eastern, North African category. But the third requirement was detailed data, mandatory collection of detailed data. This is epically changing and deeply important. And actually, the other 2 categories only get supercharged by having the addition of the detailed data. People who work with MENA communities tell you that that's only a meaningful data category if you get the detailed data. Why am I harping on this? Because what we've been seeing in implementation is that we are seeing the combined question. We are seeing MENA. What we're not seeing is detailed data. No one's surprised, because people are going to call it too burdensome, and we're in an administration that, absolutely despises anything that smacks of regulatory burdens. So what are we doing while we are still trying to advocate for that at the federal level? We are encouraging our state partners to go full speed ahead in implementing SPD 15, and especially looking at implementing requirements for disaggregated data. Our latest report on this will be released tomorrow. You heard it here, folks. So it's at wearethedata.us. We are very pleased with the name of that website. So what are the other threats we're seeing? We know them. Resources, right? That's funding and staffing. We are seeing it across the federal government. It affects the Census Bureau too. Outreach to communities to fill out surveys. Denice Ross talked about advisory committees. It is going to go beyond that, in my opinion, where the concept of having target in our new anti-DEI environment. Everyone has talked about trust, declining trust in surveys, trust about data sharing, and then general politicization. And by that, I'm referring to legislation that we're seeing in Congress to not only add a citizenship question to the census, but it would be an immigration status question, and to exclude non-citizens from apportionment counts. So these are deliberate attempts to ignore particularly the 14th Amendment, and to start having skewed data sets. And we're already going to see a depression in response rates just with everything's happening already, and this will just aggravate that. What are we doing to help it? We've launched DDAN, as I said, where we're really trying to provide resources and community to our local partners to do this work. We are doing advocacy around the pernicious legislation that we're seeing. We are putting together an advocacy toolkit so that people who are like, hey, I don't normally do this stuff, will start having the baby steps to understand how to do this work. Data Watch is a huge part of that. We are so thrilled that we were able to be part of that formation. And also, I'm talking about Data Index, but within that, there's something called Data Watch, which tells you which Federal Register notices are impacting data, and so that we can encourage people to write comments. If you think people don't pay attention to this, that's not true. The National Crime Victimization Survey had stopped asking the SOGI question, despite statutory requirements to do so. And after we started pointing this out, they put the question back. Now, we don't have a complete victory there, but we had part of a victory there. So having people write comments is meaningful. We have our roadmap to 2030 website, which is Census. Oh God, I've forgotten. I'll put it in the chat when I remember. But that gives actionable steps people can do towards the census. We have a data preservation working group on preserving race and ethnicity work. You can sign up to join one of the 4 subcommittees that are doing the work. Joel is there co-leading the comms component of this great body of work that we're doing. And on top of that, I really think we all need to come together and start establishing a framework of data governance and data principles that we can all agree to, and understanding what does privacy and confidentiality mean in this context. Because until we restore public trust, all of us can work in our silos, but we all know that whether it's me talking about the census or Ann talking about NCHS, the issues that we have are not going to be solved until everyone starts having trust in and belief in the importance of public data and that it be used for the public good. So, and finally, and this, this is an Easter egg for people who know me well. I really want to put together an activation called Day Without Data. If you think this is a great idea, please reach out to me, because I think if we can make everyone understand what central importance data have in our lives, not just in terms of AI trying to eat up the data and create algorithmic futures that we don't want, but in terms of how it is currently helping our day-to-day lives, reach out to me. I'm really trying to get that off the ground. So with that, I did it in 5.5 minutes.
Meeta, thank you so much. 5.5 minutes is great. I am going to give you just 30 more seconds. You mentioned both SPD 15 and the acronym MENA. I think most people on this call probably know what those are, but some may not. Could you just give a 1 or 2 sentence description of the SPD 15 revisions, and also just what MENA stands for, how it relates?
Absolutely. So the Office of Management and Statistical Policy Directive number 15, that gives the sort of format and rules and regulations that federal agencies must use in collecting race and ethnicity data. In March 2024, they released the newest revision in 27 years to the race and ethnicity data collection standards that apply across federal agencies. And in that, the race and ethnicity question has become one question: what is your race and or ethnicity? And it added the MENA category, which is Middle East, North African category. So now when you look at it, you'll see one column that has all the choices, including Hispanic and MENA, and people can select as many as they choose.
Perfect. Thank you so much. And thank you for that fantastic overview and for everything you all are doing, which is just amazing and essential work. We have a little more than 10 minutes and 2 more terrific panelists. So I see there is a lot of Q&A going on in chat, so I think rather than having a Q&A session, please keep it going in chat. There are also some terrific resources being shared in chat that I encourage you all to take a look at as well. I'd like to turn now to Dr. Margot Brown. She is the Senior Vice President for Justice and Equity at the Environmental Defense Fund, where she has launched the Frontline Research Institute, or FRI, pronounced FREE. She has a long history of work on environmental justice at the state and national level, including her work as Deputy Director of the EPA's Office of Children's Health Protection. So, Dr. Brown, you're leading a growing initiative on climate and environmental justice at one of the country's largest environmental organizations. One of the first things the Trump administration did was to take down information and online tools for understanding climate and environmental impacts on frontline communities. What kinds of data do we need for the kinds of programs that you support, and what can we do when government data like this disappears?
Thank you, Joel, for inviting me to participate in today's conversation, and thank you to all of our attendees. There's two things I'm going to talk about really quickly. And the first is sort of what we know to be true at the Environmental Defense Fund and what we've done. And I'm going to start with quoting what Dr. Schuchat said, and I thought it was so imperative. I've never heard this quote before. I'm sure people who are engrossed in data have heard this, but what gets measured is what gets done. That is so critical because without data, we would have not been able to reveal the deep and often devastating connections between climate change and human health. And what we know at the Environmental Defense Fund is that this data has been incredibly informative. It's transformational and it's driven climate solutions. And it's not just driven climate solutions, but it has saved lives and created public health interventions. And it's sparked action from city halls to Capitol Hill. So to advance really meaningful environmental and climate justice work, especially for frontline communities and historically overburdened communities, we need data that has three parts to it. It must be comprehensive, it must be localized, and it must be accessible. So what we need to look at is cumulative environmental burden data. We're also looking at public health outcomes. We're looking at socioeconomic vulnerability. We're looking at climate risk factor projections. And we're looking at community knowledge and really uplifting and upholding lived experience. So it's not one of these factors, it's all of these factors. And it's so much data. It's not just one set of like environmental data. So I'm going to talk really specifically about what we've done here at the Environmental Defense Fund. And that is, we created in 2023 the U.S. Climate Vulnerability Index. We refer to it as a CVI. And the CVI is an incredibly powerful tool because it integrated 184 data sets to assess over 70,000 census tracts. Let that sit in, 184 data sets to assess over 70,000 census tracts. And what the CVI does is it reveals where risk of climate change intersect with the most severely socially and economically vulnerable communities. And it doesn't just show where climate resilience is needed, it shows why, like, we can help policymakers and community take targeted, data-informed action. And how did we get here? We got here because the CVI was built with close community consultation. And that's so incredibly important because we didn't just create a tool that we thought as, scientific experts at EDF was needed. We created a tool based on the lived experience and the deep expertise within communities. And that's how we got to 184 data sets, is because the communities came back and they said, we need you to include more information on education or crime or all of these different variables. And they really urged that the tool integrate climate hazard data, which is like heat and flooding, demographics, and an array of health indicators. And what it resulted in it is communities at risk for climate change, and it highlighted gaps in adaptive capacity. And this is so important because One of the things that we try to do at the Frontline Resource Institute is really support the capacity needs of frontline leaders. We're not telling people what they need to do or what they should be measuring, but we're asking them, where are your gaps in capacity and how do we fill those gaps? And one way that we fill those gaps is through data. The CVI was originally built for policy development for community planning or advocacy to address climate impacts. It was also used to help target resources for vulnerable populations so they could use this data or this summary for grant making and really looking at various levels of locality. So whether it's at the census tract level, the county level, or at a national level, we could look at all of this data. The CVI has become incredibly important now. We built it as a tool that sort of sat in parallel and had different roles than the CGES tool that was created by the WEJAC or EJ Screen. These were complementary tools, and we thought, all of these tools could work together. And now the CVI is really, there are some other tools, but they're, I'd say, a very small handful of tools right now that are able to do what the CVI is measuring. And the great news is that it's an independent tool that was built with researchers at EDF and Texas A&M. The downside is that as federal data becomes more compromised, it's going to be much harder for us to update and implement that tool. And so what we really know at EDF is when administrations begin to restrict or dismantle public access to climate, health, and data, as we're currently seeing, it's not just a setback, it is an erasure of lived experiences. Let me say that again. It's not just a setback for data, it is an erasure of what we are seeing in real time with our own eyes. It also undermines our ability to hold polluters accountable. It undermines our ability to allocate resources equitably and shape policy that delivers justice. So we really believe now more than ever, we have got to protect and invest in the data that tells the full story of our climate crisis and how it's going to affect our health, our communities, and our collective future. And we've got to make sure that folks maintain access to information so we don't just lose knowledge, because one of the things that we know is that we're going to lose knowledge through these actions, but we can also lose the power to act. Because if what gets measured gets done, if we can't measure those things, then we lose the power to act and we lose our ability to demand justice. Thank you, Joel.
Dr. Brown, thank you so much. And thank you for just putting together such a phenomenal tool and resource for folks to use. And we've put the link in chat. I hope a lot of people will use that as a resource and check it out. We're going to go just about 5 minutes over for those of you who can stay, because Dr. González, I want to make sure you have the time you need, and also we'll turn to Cameron Hickey from NCOC just at the end for a few words. So Dr. Sylvia R. González is Director of Research at the UCLA Latino Policy and Politics Institute, where she leads work at the intersection of environmental justice, health equity, and economic mobility. Her research focuses on what a just transition will look like for Latino communities and neighborhood data to drive policy change. She's a co-investigator for the new Latino Climate and Health Dashboard, a public tool that tracks environmental exposures in frontline Latino neighborhoods across California, and really brings deep expertise and community engaged research. So Dr. González, to follow on some of the themes that Dr. Brown talked about, you're also working at the nexus of climate, environment, and health, and the ways those factors impact communities, with a focus on communities in California. If you could talk about how you see those issues playing out at a state level, and how states and universities in partnership can help provide the data that we need to work on these issues.
Absolutely. Thank you first for the invitation and for everyone for being here today. I do want to go back to Denise's point. I know I don't have a lot of time, but Denise, you made a really incredible point about changing narrative around why data matters. And I want to start the conversation today, or my conversation today, around my story about why data matters. At the Latino Policy and Politics Institute, we focus a lot on narrative change, particularly around disaggregated data. We always say that the Latino community is not a monolith, that we have so many different communities and different experiences. For example, I'm a daughter of immigrants, a first generation researcher of color. So today's discussion really around data preservation isn't just some abstract idea. We are at a time when Latino communities, when immigrant communities are being persecuted through fear, being forced to be invisible. So the politically motivated erasure of data on health, on environmental justice, on disaster preparedness, on immigration status, on race, it's all very personal to the work that we do. I often say that the data that we collect, that we work with, they're not just numbers, it's our family, it's our neighbors, it's the people that we really care about. So this topic is really about the erasure of our communities, of my community. And to Margot's point, because we don't have access to these data, it often takes away the ability for frontline communities to speak about injustices, to uplift our experiences, as well as to uplift our contributions to American life. And that really contributes to the negative stereotypes that we often see being used to politicize different programs in different states. And so going back to your question, Joel, how do I see these issues playing out at a state level? Our team has been very proactive in advocacy to inform state level responses. What we've done is to initiate discussions with various state agencies and elected officials to advocate for them to do things that were not happening. And these were two specific issues. One, proactively to start identifying data sets that are at risk of disruption. And then two, prioritizing data sets that do not have local backups. And so what do I mean by number two of local backups? Those are data sets that really rely on federal portals for public dissemination and for archiving. And so that means that there's data sets that the state doesn't know about yet, that once they leave state repositories, they no longer exist. And so the priority for us has been really for state agencies to get their ducks in a row, proactively start identifying those data sets that are at risk of that disruption. Again, what we found is that most state agencies have not been thinking about data preservation, despite the previous experience that we had in the first administration. They were still caught off guard by federal cutbacks. And so we really do need to ensure that states are investing in understanding these dependencies. The reality is that when federal regulations are weakened or dismantled, states are going to follow suit by not collecting essential data simply because they're no longer required to. There's no motivating factor without that statutory requirement. So in California, our concern is really amplified by the pressure of a budget deficit that we have. And then in terms of your second question, Joel, the role of universities, the footprint of universities is incredibly broad. UCLA alone has over 100 research centers spanning from health, environment, STEM, social sciences. There's over 6,000 projects that are going on at the same time in any given year. At LPPI, we have a team, and I see that G is joined us from the Latino Data Hub. It's one of our two big data infrastructure projects, the other one being the Latino Climate and Health Dashboard that we've recently launched to be able to ensure that our community continues to have access to census data, disaggregated data. So I encourage you to visit those sites. I think they'll be shared either over email or in the chat. The other thing that LPPI has been doing is just internally, we wouldn't be good researchers if we don't create a survey to understand what's happening at our university. So G, who is in the chat, and you can get her contact information if there's any interest. She recently launched a survey across the different UCLA centers to document the impacts, build collaborative responses. And so we're continuing to have those conversations internally. In terms of concrete roles for universities, there's still a lot of coordination that needs to happen, and needs to happen very quickly. I think that universities can play a contributing role with statewide partners to at least ensure that state level data collection efforts continue and stay resilient, regardless of any federal policy shifts, and then also continue to fill data gaps, whether it be through archiving and disseminating existing public data sources or collecting new data with our partners on the ground. And I want to emphasize with our partners on the ground and using methodologies that are not extractive of our communities that are already vulnerable during these times. And so with that, I will stop and I'll turn it back to Joel.
Great. Dr. González, thank you so much. And again, I just want to thank, I wish we had another hour. I just want to thank all the panelists for this just incredibly, incredibly rich discussion and all these different perspectives that really all converge on the same major issue, which is the incredible need for accurate, complete, reliable data for the nation's health, the challenges we're facing, and the different creative ways that people and organizations are finding to address those. Want to let you all know, if you've registered for this webinar, you will be hearing from us. We at Code will be following up with more information, synthesizing what we've learned. We will make the recording of this webinar available. But before we sign off, I do want to introduce Cameron Hickey, the CEO of the National Conference on Citizenship, or NCOC. NCOC is our partner in hosting this webinar and tomorrow's roundtable. They're an organization dedicated to strengthening America's civic life, and that gives them, of course, a strong interest in the issues we've been discussing today. And Cameron, if you'd like to just say a few words about NCOC and also some of the upcoming opportunities that you all have.
Absolutely. Thank you, Joel, and thank you to everyone who spoke today, and for everyone who tuned in. As you may know, the National Conference on Citizenship has long been focused on leveraging federal data to measure civic health and, more recently, public health. I want to take a moment to remind everyone who doesn't know that our organization will be hosting an annual conference on citizenship in Washington, D.C. this September on the Tuesday, the 16th. This year, we're going to be focusing on building civic resilience, and we'll be featuring the findings of this roundtable work, as well as a number of the folks and organizations represented on the call today. So I encourage you all to join us in person in September to get a readout of where things stand after this roundtable process concludes, and join us in person to talk about the future of building resilience around data together. Thank you all so much for being here. We're really honored to be a part of this and support Joel and the team at Code, and look forward to talking with you over the next couple of days. So thank you.
Fantastic. Cameron, thank you so much, and wonderful for us to partner with you as well. That ends the public webinar. Again, tremendous thanks to our panelists and to everybody who joined. I hope you've all had a chance also to see all the resources being shared in chat. For those of you who are going to be at the roundtable tomorrow, we're going to take just literally a 2-minute break, but if you can stay on this Zoom call, we'll have some logistic information for you all. For everybody else, thank you so much for joining today. This is such important work and so much that we need to work on together. Really appreciate your being here, and we at Code are committed to continuing this work, helping bring folks together, and we will keep you posted on what we find as we continue our work as well. Thank you so much, and roundtable folks, we'll see you in 2 minutes.